Good morning, everyone. Thank you so much for joining us for the Retiree Dental and Vision webinar. My name is Jessica Shee. I'm the Communications Director at SFHSS. I'm just here to kick off the event and tell you about a few quick things for our event overview. Next slide, please. Thank you so much. So everyone will be on mute for this entire presentation. However, we love getting your questions, so please look for the little Q&A box that should either be at the top or bottom of your screen on the menu bar. It should have a little question mark on it. And if you click on that, you'll be able to open up a Q&A chat box. You can send us any questions that you have regarding your dental or vision benefits, and we will be happy to answer them during the live Q&A, which will happen right after all of the presenters finish their presentations. And we're going to answer as many questions as we can during the session, and we hope to get through all of them. But if we don't get through them, please feel free to reach out to member services. Thank you so much, Olga.
Hi, my name is Emily, and I am one of the 25 SF Health Service System Benefits Analysts who answers your calls when you have a benefits question. We're so glad you've joined us for the Dental and Vision Benefits webinar because I've personally experienced a situation in which I was not familiar with my dental benefits and went through a tough time with understanding what was covered. I had a lot of back and forth communication with my orthodontic office, and I later realized that I could have called SFHSS, who would have been able to tell me that the service had a maximum that I had already reached, or they would have directed me to contact my dental insurance for this information. So the lesson is to stay informed of your benefits, which you have already done the first step by attending this webinar, and that you can always call SFHSS if you have any questions or are unsure of your benefits. I hope you find this webinar to be helpful and informative. Cheers and happy open enrollment.
Hello. Today, Delta Dental will be presenting on Keep Your Teeth for a Lifetime by using your PPO dental benefits. This is for retirees. Today, we'll be reviewing why dental coverage matters, COVID-19 and dentistry, review of your dental benefits, and dental plan resources. Why does dental coverage matter? Let's have you answer the following question. How many American adults have had a cavity? If you answered D, 92%, you are correct. 92% of adults ages 20 to 64 have had cavities in their permanent teeth. 26% have untreated tooth decay. Having dental insurance stops problems before they start. Half of adults are affected by gum disease, and the most prevalent chronic disease in children and adults is tooth decay. What happens during a cleaning? During the webinar, we'll be watching this short video. But for now, we'll be moving on. COVID-19 and dentistry. How have things changed? Is it safe to visit your dentist's office? The simple answer is yes. Your dentist disinfects the surfaces in your treatment room and sterilizes the instruments used in your mouth. This is even more enhanced. You've probably seen, if you've been to the dentist, even a humidifier or an air purifier in each of the rooms. Many items used are disposable. They're single-use items that are discarded after the patient's used. And your dentist may look a little different when you return. They may now have a special mask, a face shield, and a gown. Some other strategies to keep you safe and have been implemented due to COVID-19 is the health screening before you enter. Your dentist may either email you or text you a COVID health risk assessment. This questionnaire needs to be completed prior to your appointment and on the day of your appointment. Your temperature will also be taken. And you may notice that there's more space between the appointments between patients. So in the waiting room, you may be the sole person in the waiting room waiting for your dental hygienist or dentist. If you're still a little fearful about going into a dentist's office, there are 2 teledentistry software application and a virtual consult that we'll talk about now, where you can still get a diagnostic exam. By using Toothpick or virtual consult, it will count towards your diagnostic exam. So how does Toothpick work? Toothpick is a phone-enabled app. You are taking a health habits quiz and taking photos of your mouth. The app guides you to take a really great picture, and then you remit that quiz and those photos via the app, and a licensed Delta Dental dentist will provide you a report within 24 hours as to what they see. Another way to use a virtual dentist is through virtual consult. Virtual consult also would count towards a diagnostic exam, and you receive 2 exams per calendar year. Retirees have a DMP waiver, so this exam won't count towards your maximum. You would schedule a live virtual video consult with a Delta Dental PPO dentist. This may not be your dentist that you're currently seeking services from. It's from a list of PPO dentists that have agreed to provide virtual consult. These are real-time video appointments via your computer with a PPO dentist. And this dentist can prescribe if there is pain and there is a necessity for prescriptions. Your mouth and your body, there are far-reaching oral impacts. Glaucoma is a disease of the optic nerve, and tooth loss, as well as gum disease, may increase your risk of this condition. Migraines may be linked to certain bacteria in your mouth. And acid reflux can be detected by looking at enamel on your back molars. Hopefully you're very familiar with this screen, your retiree Delta Dental PPO benefit highlight sheet. We're going to go over a couple of key items on this page now. Deductibles. If you seek services from a Delta Dental PPO dentist, you will have no deductibles. Whereas if you seek services from either a Premier or an out-of-network dentist, you'll have to pay $75 per person each calendar year, or $150 per family each calendar year. So if there's 3 people in your family covered under your plan, 2 of them would need to submit or reach the $75 to equal the $150 per family. As I mentioned earlier, your deductibles are waived from your diagnostic and preventative services. Diagnostic and preventative services are exams, cleanings, and x-rays. If you seek services from a Delta Dental PPO dentist, your exam, cleanings, and x-rays are covered at 100%. If you seek services from a out-of-network dentist, those services would be covered at 80%. So using our deductible, starting with a fresh, as of January, you haven't sought services from a dentist yet, you go to an out-of-network dentist for your exam, you would be responsible for $75 for a deductible, and then 20% of those reasonable and customary charges. Some new benefits that hopefully you're familiar with as of January 1st of 2021 are nitric oxide and non-IV sedation. There's also support for chronic conditions. If you've been diagnosed with diabetes, heart disease, HIV/AIDS, rheumatoid arthritis, or stroke, you can take advantage of expanded dental benefits by enrolling in the Smileway program. You would need to call Delta Dental's contact center at 888-335-8227 in order to enroll in the Smileway program. This provides additional coverage, 100%. And as you can see on the right-hand side, for scalings or root planing, and 4 of the following per calendar year of any combo, teeth cleaning or gum maintenance. There is a difference between seeking service from a PPO dentist versus an out-of-network dentist. You can save more money by choosing a PPO dentist, whereas if you seek services from an out-of-network dentist, they can balance bill you. The difference between Delta Dental's payment and their submitted fees. Anytime you're having a dental treatment in excess of $300, you should request a pre-estimate before receiving the care. An example of the balanced billing that we talked about just a few seconds ago is illustrated on this implant exam. As you can see on the top, there is an annual maximum. That is the maximum amount of money you are allotted each calendar year to spend towards your dental benefits. Once you exceed that $1,250, all other expenses would be your cost. Individual, as you can see, there's no deductible seeking services from a PPO dentist, whereas if you seek services from Premier or out of network, it's a $75 per person deductible. Your dentist submits fees, and in this case, $2,400 for the implant. The plan, Delta Dental, approves accepted fees. They have a set amount that they will reimburse a dentist. In this case, it's $1,600 for PPO, $2,200 for Premier, and $2,400 for out of network. Your plan maximum allowance, what your plan will cover, is $1,600 for your PPO, $2,200 for Premier, and only $2,200 for out of network. So you see right here, there's $200 difference between what the plan is accepting as acceptable fees, but what the maximum amount we will pay for that procedure. Then your coinsurance kicks in. And if we stay in the out-of-network, the last column, 50%. So 50% of $2,200 is $1,100. So Delta Dental will pay $1,100 and you will be responsible for $1,400. This $1,400 can be balance billed by your dentist. Of course, when you look at a PPO dentist, here the patient pays only $640 and your coinsurance is 40%, where we're picking up 60%. Comparing Delta Dental PPO plan to Delta Care USA, because during enrollment, open enrollment, you have an opportunity to select or change plans if you would like to do so. If not, don't worry, and you can pause while I explain this slide to individuals who are making that consideration during open enrollment this year. So, can I go to any dentist? Under a PPO plan, yes, you can go to any licensed dentist to receive your dental coverage. Whereas under the Delta Care USA plan, you must select a primary care dentist and visit this dentist to receive benefits. For procedures that are covered under a PPO plan, you have a coinsurance, such as in the prior example, the implant, 50%. Whereas Delta Care, there are no or low co-payments for procedures. If you want to seek services from a specialist, you do not need a referral under the Delta Dental PPO plan. Whereas under Delta Care USA, you would need to coordinate that referral with your primary care dentist. And the most important item would be the out of area coverage. So if you're outside of California, you can seek services from any licensed dentist under a PPO plan, whereas only dental emergencies would be covered outside of California under the Delta Care plan. Brush Smart is a at-home oral wellness program. There's an affiliation we have with Philips to provide discounts on Philips Sonicare products. To learn more about this benefit, go to brushsmart.org, all one word, and you can see and find out more about the discounts on the different Philips Sonicare products. There are many dental health resources on your microsite and on our normal, regular Delta Dental webpage. Articles, short videos, tooth-friendly recipes, quizzes for dental risks, and of course, you can sign up for our Grin e-magazine. Online accounts are very important, and creating one is super easy. Go to your microsite, which is www.deltadental.ins.com/group-sites/ccsf.html. That is your microsite where you can find plan details and wonderful information. But on the middle of the page, you'll see a sign in/register. Click on that icon, and it's a quick registration to begin receiving your explanation of benefit statements or pre-estimates electronically. You can review your plan details, verify who's covered under your plan, and if you would like, view or print an ID card. Although, as you know, when you seek services from a Delta Dental PPO dentist, no ID card is necessary. Other ways to contact Delta Dental are calling us toll-free. For the PPO Delta Dental plan, that number is 888-335-8227. And for Delta Care, it's 800-422-4234. You can also visit your microsite, and it's always a great idea to check your benefits highlights and plan booklet. Thank you for your time today. We are pleased to take any of your questions.
Thank you for taking the time to viewing your United Healthcare Dental HMO retiree benefits. So who is eligible for dental benefits? Employees and retirees. Their eligible dependents include spouses, domestic partners, children up to the age of 26. Good oral health may be linked to reducing the cost and complications of many high-risk costly conditions such as diabetes, heart, and kidney disease. A whole person approach is designed to link medical and dental data to help close gaps in dental care for employees with chronic conditions, with the goal of helping improve overall health and lower costs. Gaps in oral care are characterized as a lack of oral health care received within the previous 6 months, as well as the type of oral health care being received. We outreach to identified employees to help them close their dental care gaps, which may help them achieve better health and save money. Condition-specific data includes diabetes. People with diabetes are more likely to have gum disease. If left untreated, this can help make it difficult for them to stabilize their blood sugar. However, those who receive gum disease treatment may see a positive impact on their blood sugar levels. Heart health. People with gum disease are nearly twice as likely to have heart disease, pregnancy, Gum disease in pregnant women may be linked to complications such as preterm birth and low birth weight. Asthma. Employees taking asthma medications may be at risk of cavities, dental erosion, periodontal disease, and oral candidiasis. Kidney disease. Treating gum disease helps reduce inflammation, which can reduce the risk of kidney failure. Chronic obstructive pulmonary disease, or COPD. Periodontal disease may increase the risk of a respiratory disease. We address individual needs with a whole person approach that includes both preventative and at-risk outreach. 98% of targeted employees were successfully reached either by phone or by mail. Preventative care includes wellness benefits at 100% in network, 2 routine checkups every year, extra cleanings and treatments for expectant mothers, extra dental visits during pregnancy. Annual oral cancer screenings are covered for adults 18 and up. We help at-risk employees through enhanced benefits that provide additional preventative and periodontal benefits, including expanded coverage for pregnant employees. Dental activation combines medical and dental data to help identify at-risk employees and assesses whether they're getting dental care to manage their condition. Timely interventions, these encourages employees to seek oral health care. Select Managed Care, or DHMO plan, helps maximize savings through a more localized network and a focus on coordinated care. Plan features include no deductible, no annual maximums, and no waiting periods are required. You must select a primary dentist within the state you reside in. Referrals are required to see a specialist, and please remember that services are covered in network only. Restorative services. Most services require a small copay, but please refer to your plan summary for additional information and costs. Using your dental benefits is easy. First, you must choose a network dentist. You can choose a dentist for each one of your family members. Second, you show your ID card. Third, you pay your copayment. And fourth, your claim will be submitted for you. Here are a few points to remember. Network dentists are board certified dentists. No deductible, no annual maximum, and no waiting period is required. No claim form for covered services, low predictable dental costs. Good oral health may be linked to reducing costs and complications of some high-risk costly conditions such as diabetes, heart, and kidney disease. Individuals are addressed with a whole person approach. Preventative and at-risk outreach is included. And please remember that only in-network services are covered. Are you ready to enroll? Well, first, we encourage you to review your plan materials. Second, go online and visit www.yuhc.com/SFHSS. You must enroll during your initial eligibility or annual enrollment period. Thank you for attending.
Thank you for taking the time to learn more about the vision benefits San Francisco Health Service System is offering you in partnership with VSP Vision Care. When you choose a VSP Vision plan, you will receive great savings when you visit a VSP network doctor. With both the basic plan and Premier Plus plans, a well vision exam is covered in full every calendar year with a $10 copay. Both plans also include primary eye care, which includes treatment and monitoring of common eye conditions like pink eye, as well as more serious conditions every calendar year with a $5 copay. With the basic plan, prescription lenses are covered every other calendar year, a frame allowance of $150 every other calendar year, fully covered single vision, lined bifocal or lined trifocal lenses for adults, as well as fully covered single vision, lined bifocal or lined trifocal polycarbonate lenses for children every other calendar year. The base plan also offers scratch-resistant lenses and standard progressives covered in full. Or You can choose contacts instead of glasses with a $150 contact lens allowance with a copay of up to $60 for the contact lens exam every other calendar year. With the Premier plan, prescription lenses are covered every calendar year, a frame allowance of $300 every calendar year, fully covered single vision lined bifocal or lined trifocal lenses for adults, as well as fully covered single vision lined bifocal or lined trifocal polycarbonate lenses for children every calendar year. The Premier plan also offers scratch-resistant lenses and standard progressives covered in full. Premium and custom progressive lenses, as well as anti-glare coating, are covered in full after a $25 copay. Or you can choose contacts instead of glasses with a $250 contact lens allowance with a copay of up to $60 for the contact lens exam every calendar year. Now let's dive into the great benefits and savings you get as a VSP member through San Francisco Self-Service System. VSP members save an average of $851 every year with a VSP network doctor. And savings are built into your plan, which means you'll get a great deal on services like eye exams from the nation's top providers, fashionable frames and prescription glasses and sunglasses, lens enhancements like anti-glare coating and light reactive lenses. You'll also enjoy savings on additional lens enhancements and contact lens services. Based on applicable laws, benefits may vary by location. We have the right network in place, including independent private practice doctors, Premier program locations, and VSP's preferred online retailer, Iconic. There are more than 8,000 regional retail chain locations on the VSP network. Our retail chain providers also include Costco, Optical, Pearl Vision, and VisionWorks. All VSP members have access to the Premier program, which is part of our incredible network of highly knowledgeable doctors. VSP network doctors who participate in the Premier program provide the personalized attention you want and the ease you need. They also carry the latest technology available and provide bonus offers that are exclusive to Premier program locations. Simply put, members get the most from their benefits when they visit a Premier program location. As a VSP-owned company, Iconic is the only website that seamlessly connects VSP Vision benefits to a member's account. By applying your vision benefits, you see savings in real time. Save time and money on quality eyewear with a few easy clicks. 1. Connect your vision insurance. 2. Select your product. 3. Upload your prescription or provide your doctor's contact information and we'll take care of the rest. Iconic offers a variety of well-known name brands and contact lenses. Choose from over 50 eyewear brands and over 1,600 styles. At VSP, our commitment to your well-being extends to your financial wellness. Members get access to exclusive member extras, up to $3,000 in savings on leading industry brands. Plus, VSP members always get an extra $20 to spend on featured frame brands. That way you get the low out-of-pocket cost your family needs. Exclusive member extras includes special deal on glasses, extra $20 on featured frame brands, save up to $20 on non-prescription sunglasses, save up to 60% on digital hearing aids. Visit VSP.com to see additional savings on LASIK, diabetes care, hearing aids, and financing. Offers vary based on your benefit plan. And using your VSP benefit is easy. Once your plan is effective, you can create an account on VSP.com to review benefit information and view the doctor network so that you can find an eye care provider who's right for you. And don't forget, you can maximize your savings when you visit a Premier Program location. Then, at your appointment, simply tell your doctor's office you have VSP. There's no ID card needed or claim forms to complete when you see a VSP network doctor. While a member vision card is not needed to obtain services, you can download a member vision card by logging into your VSP.com account. A note on enrollment. If you enroll in the Premier plan, you must also enroll any dependents you wish to be covered. Enroll in VSP Vision Care from October 1st to October 29th to enjoy the complete coverage and the quality care you deserve. To learn more, contact us at 1-800-877-7195 or visit us at vsp.com.
Great, thank you so much to all of our presenters. So I already see we have a lot of great questions in the Q&A chat box, so I am just going to start from the top. This first question, I believe, is for Delta Dental. Sharon, if you are available, we have a member who asked, my dentist will stop using Delta Dental in 2022 because Delta Dental does not pay enough. Why is this? What are my options in San Francisco?
This is a great question, and thank you so much. I've seen a number of questions for me in the chat, and I've been going back and answering those. But to answer this particular one, oftentimes a dentist will leave our network, and we have two different types of contracted dentists. One is a PPO dentist, one is a Premier dentist. And those contracts with those dentists allows or affords you discounts, meaning that they can only charge the contracted amount for a dental procedure. When a dentist decides to leave our network, it's typically because they have an established clientele, and meaning, dentist members, and they want to be able to charge more for those dental procedures. And so they discontinue their contract relationship with us. That then results in their ability to balance bill you. So they can, they are no longer limited to a contracted fee, such as for a crown or for an implant. They can charge whatever the going rate is basically out there in the marketplace. You can continue to seek services from that dentist. We consider that an out-of-network dentist. Just realize that if you are having procedures that are going to cost more than $300, we highly recommend that you get a pre-estimate prior to that, so that at least you'll have an idea as to what those charges will be. Otherwise, there are many dentists in the San Francisco as well as the Bay Area, and it's very easy to find a PPO dentist by either calling our contact center or going online to your microsite and just going in and putting in your zip code. There's a little Find the Dentist. Just putting in your zip code, and if you're looking for a specialist, you can delineate that in there. If not, and you're just looking for a general dentist, just your zip code, and it will present a huge list of dentists and options for you.
Thank you, Sharon. The next question is for you as well. My dentist changed to Premier. How do I change my Delta Dental plan from PPO? And I see that you've already provided an answer, but could you read it out loud for the benefit of all of our members?
Yeah, great. Thank you. So you do not have to change. The PPO plan covers Premier dentists. It's just that if you do seek services from a Premier dentist, which is also contracted with us, we consider that in your plan. You have a PPO dental plan. We consider that an out-of-network dentist, and so the deductible would apply. And then there's just a lesser co-insurance, meaning that we would cover less by seeking services from a premier dentist. However, as we were talking about earlier in that first question, you are still very protected by Delta Dental by seeking services from a premier dentist, because they can only charge the contracted fees for that dental procedure. They cannot balance bill you. And we also have them certified. We regularly monitor our contracted dentists to make sure that they're providing the best dental care out there.
Thank you, Sharon. And the next question is for you again. Would one of the dentists, or I'm sorry, let me make sure I understand this question. Would Delta Dental PPO cover when traveling outside the US? And I saw that you answered the question, but could you elaborate? Because even if it is yes, I'm assuming the member would have to pay upfront, and that they would be, it's probably going to count as an out-of-network. Could you just elaborate on that?
Yeah, so no, really good question again. If you, let's say you're traveling in Europe, to Jessica's point, it would be a covered dental expense. However, you would be, the dentist would want to receive payment in their, the money, right? So the European market definitely would pay based on that, depending on where you are, right? Outside of the US, whatever that currency is. What you would want to get from that dentist is a copy of all the dental procedures. And if they could convert that into English, that would be extremely helpful. However, not necessary. We do have translators that when you get back to the States, what you would do is download a claim form. That again can be found on your microsite, or you can call our contact center and we can send you one. And then you would submit that claim form with a copy of all those dental procedures that you had while visiting that dentist outside of the US. And then we would just process that claim. It usually takes a little bit longer to process those claims because, of course, right, it's a manual intervention. We're needing someone to translate that claim, and then there might be some questions going back and forth between our claim center and you if we need a little more details. Otherwise, then we'll send you a reimbursement check for those procedures.
Thank you, Sharon, and that you're just very popular this morning. So the next one is, how do you supplement the $1,250 yearly annual maximum? And I saw that you did answer the question, so thank you. But I think beyond, I want to take this question a little bit further and really help the member, because a lot of times the dental procedures do cost more than that. Do you have any strategies? Like, should they schedule their procedures over maybe at the end of the year, starting into next year, so that they can also tap into next year's annual maximum? Are there any strategies they can employ if they have a very expensive procedure?
Yeah, great, again, question, audience. Thank you so much. And Jessica, thank you so much for setting that up. Yes, unfortunately, there is no way to supplement the annual maximum of that $1,250 that you're allotted. Each person is allotted, that is covered under the dental plan. So there's no way to supplement it, but that is correct. So one, we would again recommend any procedures over $300 to get a pre-treatment estimate prior to having those services rendered. Again, that just gives you a very detailed synopsis of the procedures that are going to be done during your dental appointment, and also the cost, and then what our coverage, so applying your benefits, and what we'll cover so that dollar amount, and then what would be your responsibility. The other, what Jessica was alluding to, is also trying to plan those high cost dental period or procedures to straddle 2 different plan years. So if you're going in November or December and the dentist says, oh, you're going to need a crown, you could start that root canal in, let's say, 2021. We're in 2021 as an example. And then the crown could be done in 2022. And so you've got the 1250 calendar year maximum that could be utilized for 2021 for that root canal. And then it's going to reset to 1250 again each plan year, January 1st. And then that could be utilized for that crown. So that's one way to really talk through with your dentist that planning of high cost procedures. And I also just highly recommend just really working with your dentist. A lot of times there's a long-term relationship that you've established with your dentist, and really talking through that financial just hardship maybe with them, and maybe again they can do something to either a payment plan or maybe even reduce the cost of those procedures for you. Just having that conversation, it's always worthwhile.
Thank you, Sharon. And the next question is from Larry. One of the examples given in Delta Dental presentation is for implants for retirees, but the printed matter we received says that implants are not covered. And Sharon, thank you. I see that you've replied to Larry, but I also want to clarify, because the Delta Care DHMO plan does not cover implants. However, the Delta Dental PPO plan does cover dental implants at either 60% for in-network dentists or 50% for out-of-network dentists. And remember, an out-of-network dentist can also balance bill. Sharon, did you want to elaborate on that?
No, and I'm sorry, Larry, if I assumed that you were on the PPO plan and not the Delta Care plan. So Jessica is correct. Delta Care, we currently do not cover under your plan design the implants, but PPO, it is covered.
Yeah, so if you do have implants upcoming, we do recommend you can switch to the PPO plan and get it at least partially covered. And the next question is from Joan. What is the cost of Delta Dental PPO for retiree only? And thank you, Sonali, for answering. Retiree only is $45.73. I believe this is the 2022 rates, so thank you for that. And she also shared a link where you can get your rates. Next question is there an update list of dentists that are accepting Delta Dental PPO in 2022? Sharon, can you answer how they can find in-network dentists?
Yeah, it's always great just to go to your microsite and go into the Find the Dentist. Just click on that icon, and by putting in your zip code, it will give you a large list of dentists that are in your, and they always start how we sequence our dentists when you're looking and utilizing that tool is we'll always put the PPO dentist first, and then Premier, and then there's out of network. So again, just really trying to partner, have you partner with a PPO dentist so that you are getting the most robust coverage for your plan. And again, utilizing that PPO dentist is one way to stretch that 1,250. The other is really just by calling our contact center. Our contact center is there to help you find a dentist. You may need to have a dentist speak a certain language. We definitely have dentists that look like you, speak in your language, and that is denoted on our website, but also you can call our contact center if you just have some concerns about that. We have a translation service even in our contact center. So when you're calling us and you would prefer to speak to someone maybe in Spanish or French, there are our contact center will switch you over to our kind of our translation department, and then a representative will come on the line, and then you can really have that just very easy conversation within your just kind of your native language, or maybe a language that you just have a preference in speaking.
Thank you, Sharon. And the next question is for you as well. Do codependents or dependents on the Delta Dental, on the member's Delta Dental plan, should they be setting up their own Delta Dental account as well? And what do they need to do to set up that account?
Yeah, so great question. Yes, anyone over the age of 18 and over will need to set up their own online account. Any member can see when the primary member, so the employee or the retiree in this case, that worked for SFHSS, so they can actually see who's covered under their plan, but they cannot access your claim data or any of your information. So it's really in your best interest to each individual that's in the household that's 18 or older, to set up your own online account. And again, super, super easy, going to the microsite or even going to our webpage and just clicking on that sign in. There's just a couple of quick little questions that you answer. You just type them in, and then it creates your online account. And then with that, you actually can receive emails from us. There's a couple of emails throughout the year that we send, as well as download that ID card if you wanted to have an ID card with you, maybe when you're traveling outside the US, when everything opens back up again, or you just might have that that comfort level, right, of having an ID card, even though it's not necessary. But yes, we do recommend that each individual create their own online account.
Great, thank you. And the next question, can I get dental and vision by itself without health coverage? Thank you, Sonali, for answering. So you do need to be enrolled in a health plan with HSS in order to enroll in our dental or vision coverage. Thank you for that. And the next question is, how do I find a PPO dentist in my area? I just provided the link to Delta Dental's microsite below, and you can do a provider search there. Next question is, please explain definition of coinsurance. Thank you. Sharon, could you take that one?
Yeah, so coinsurance, I'll give it your basic services. So basic services are like a filling. So that's what a similar or basic or a service that's considered basic under your PPO dental plan. So fillings are covered at 80%. So you would have 20% coinsurance. We would cover 80% of that contracted fee. So let's say that it's $100 for a filling, right? And that's our contracted rate with your PPO dentist. You would be responsible for $20, and we would cover $80 of that billing. If you were seeking services from an out-of-network dentist, they may charge $120 for that filling. And so then again, our contracted rate or our reasonable and customary rate is $100. Still same coinsurance, right? 80% in network, 80% out of network. But now we're applying that 80% to that just the $100, right? So we're still only going to pay $80 of that for that filling. But now you've got $40 that's your 20% coinsurance that's going to apply. And so instead of just $20, you'd actually be paying $40 for that plan or for that procedure. Does that help?
Thank you, Sharon. Thank you, Sharon, for clarifying that. And I just want to clarify a prior member's question regarding dental and vision. I'm sorry, I lumped them together. So your vision plan is tied to your health plan with HSS. However, you are able and allowed to enroll in dental alone without our health plan. So I just want to clarify that. So thank you so much, Sonali, for fact checking me. I do appreciate that. And then the next question was, I was under the impression retirees are permitted to enroll in the SFHSS Health Savings Account program to offset annual medical, dental, and vision expenses not covered by insurance. And thank you, Sonali, for answering. So we do not currently have a health savings account program for retirees or active employees. The only type of account we have is a flexible spending account for health expenses, as well as dependent care and child care expenses, and that's only for active employees where we can actually do the pre-tax deductions through your paycheck. And since you no longer, as a retiree, you no longer have a paycheck with the City and County of San Francisco, so we are unable to have that account for retirees. Thank you, Sonali, for that answer. And the next question is, why Delta Dental DHMO when UHC seems to use the same providers? UHC charges so little that I worry that it doesn't pay providers anything. Are co-pays less with the Delta Dental DHMO than the UHC? You know, Heather, will you explain how the United Healthcare DHMO program works?
Yes, can you hear me okay? Great,
Yes.
Good morning. Yeah, so the difference they might be seeing here, I think it's kind of hard to tell in the context, but when they say UHC charges so little, I worry it doesn't pay. I'm not sure if they're referring, so our plan is an HMO. So the difference is that instead of Sharon explaining for one of their options as a PPO, where you're gonna have an 80%, 20% coinsurance, ours is set so that there's, for many, many procedures, a zero cost share to the member, but there's still in an HMO environment, of course, a particular charge and fee that provider is being paid. So the best way to look at the HMO is on our benefit summaries through the microsites and comparison also to Delta, you'll be able to see out of pocket all those procedures where there's a zero cost share. If there is a cost share for things like fillings or crowns, or implants or orthodontia, it's going to show you what your member cost share is. So really two different things when you look at a PPO or an HMO environment and what member cost share is. And our plans happen to be HMOs where, for again, many procedures, the member won't have a cost share, but there is still a claim that's billed and that provider is reimbursed for the amount of that procedure, whether it's cleanings, fillings, whatever. Those are always negotiated.
Thank you so much. Prior question to clarify, I guess to get some clarification to your prior answer, they actually want to know why Delta Dental doesn't increase the reimbursement rate to the dentist. That they didn't want the explanation about how they are charged. And so could you answer or elaborate on that?
Yeah, we actually on an annual basis and consistently throughout, as we evaluate dentists, recertify dentists, and look at the marketplace and look at the costs of the marketplace of doing business. And so our contracted rate is actually within the marketplace, very competitive. And so there, again, I know that dentists who leave our network will refer to the reimbursement rate, right? What the contracted rate, what we are allocating back to them. And they will use that as a explanation as to why they're leaving our network. And really, in essence, what the dentist is trying to do when they leave our network is to be able to bill more for those dental procedures. They do not want to stay within a contract or within the confines of this is the fee that you will receive for a procedure. They want to be able to charge whatever they want to. And so we constantly are looking at this. We've done a lot of work with your executive team, the SFHS executive team, and we've actually even brought this to the board meetings to really show and demonstrate how many dentists have left our network in certain regions. And it's a very, very, very small percentage that are leaving our network. But one of the reasons that they provide is reimbursement. But actually, that's not the top reason. Last year, the top reason was retirement. They were leaving and selling their practice due to COVID. And so, although we do hear and we do monitor, this is not the primary reason that our dentist or a dentist leaves our network.
Great, thank you, Sharon. And the next question.
Jessica, this is the moderator, Holly. Just giving us a time warning that we have just under 5 minutes, and I can enter in any information into the chat as we close out soon.
Oh, thank you so much. And I did forget, can we add the Raffle link into the chat so that, and we want to thank everyone for participating and joining in this webinar today. And we are doing a raffle giveaway. All of our vendors have provided really fun, awesome giveaway prizes. And so we hope you will enter the raffle, and good luck to you on getting selected to win. I am going to try to get through as many questions as possible. I see there's only a few left. And also, you know, while we're here, I do want to, can we go to the last slide to tell people how they can get help? If we're not able to get to your questions today, please feel free to call our member services. They're always happy to help you. So let me see. I am going to see if we can finish some of these questions in the last 3 minutes. So I'm not in the state of California. How does Delta Dental work outside of California? Sharon, correct me if I'm wrong. It works exactly the same. It is Correct. A national PPO plan. Okay. Could my husband carry self-only medical but cover the whole family for dental? Sonali, thank you for answering. Yes, he can enroll the whole family in dental and enroll just himself in the medical plan. And is there coinsurance to cover costs over the maximum of $1,250 per year? Sharon, do you want to take that?
Yeah, so just quickly, once you exceed, right, the calendar maximum of $1,250, you're still, if you're seeking services from a PPO or premier dentist, you're still under the contracted rate. So it's meaning that the procedure is going to cost less than if you were seeking services from an out-of-network dentist. And then, yes, we would still apply the coinsurance. It's just that now you've exceeded the $1,250, and so really the cost is now going to be you'll be writing the check.
Okay, great, thank you. And this we've got a question for VSP. Nancy, are you on the phone?
I am.
Excellent. So the question is, for the VSP basic plan, if I get computer glasses, I have to wait 2 years to get regular glasses. Can you explain how that works, and how? And I'm not sure if the Premier plan could help with this.
Yeah, so the computer glasses is actually a completely separate benefit. So if you do get computer glasses, you still have access to your main set of benefits for glasses, where you're eligible for an exam every 12 months and then lenses and frames every 24 months. So even if you do get a set of computer glasses, if you're eligible for your main benefits, you would still be eligible for your regular prescription glasses as well.
Thank you. And the next question, can a retiree get second insurance through Medicare to have extra coverage for like a second insurance? I'm not sure. Is that for dental? Sharon, could you answer?
Yeah, I'm thinking it is for dental. So this would be like an individual that has selected an individual dental plan. So they've got the group plan. So as a retiree, you're considered under a group plan if you are enrolled in the HSS, Delta Dental, or United Healthcare dental plan. The secondary insurance would be like an individual plan, and then we would coordinate. So under the PPO plan, that would coordinate under a Delta Care or under a DHMO plan that there is no coordination. So under the PPO plan, we would look at both insurance plans and then coordinate accordingly.
Thank you so much, Sharon. And we are at time. I want to thank everyone for attending today. Sorry about that, back on camera. I want to thank everyone for attending today and asking your great questions. We really appreciate your time and for joining us on this webinar. And if you have additional questions, please feel free to call SFHSS Member Services. The number's on the screen. Thank you and have a great start to your day.
Thank you so much.